This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about why your knee might hurt when you go up and down stairs. If you like this video, we put out new content weekly, so please like and subscribe. So anytime you think about knee pain going up and down stairs, most of the time it's usually in the front of the knee, so you're always thinking about kneecap related issues. Meniscus or ACL related issues, if you're doing some deep bending or really pivoting, those will irritate it. But most of the time when people are doing stairs, they're not bending their knees all that much. So usually the culprit of the pain is the kneecap. The patella rides in a groove on the femur, and sometimes it doesn't quite ride right, and it kind of rubs along the sides of this groove. It's more kind of like that, and that'll cause inflammation and pain. So it can be anything there from no arthritis to a bunch of arthritis. Most of the time when a lot of people get it, especially if they're on the younger side, there isn't really arthritis. It's just that kneecap isn't riding right, and that's called patellofemoral syndrome. And the correction for that usually is physical therapy with certain exercises. You want to stretch out your hamstrings so there's less pressure on the front of your knee. Then you can do some quadricep strengthening. You don't want to do less like open chain, like when you're kicking your leg out, and more kind of like lifting your leg up and down. That'll sort of strengthen the quad without injuring the kneecap, because the problem is if you do leg extensions, then it just irritates that kneecap more. They have braces that kind of have a hole to keep your kneecap aligned. Those tend to not work too great. Sometimes they end up smushing the kneecap in more. So I generally tell people to avoid those. Sometimes there's taping, and you can kind of tape the knee so it moves correctly, and that can kind of work pretty well also. But generally speaking, if you're going up and down stairs and you have knee pain and it's in the front of your knee, it's because the kneecap is not riding right. Now you could have some cartilage injury or cartilage damage. That doesn't mean it will always hurt you. In severe cases, when the cartilage is gone, then you would need a knee replacement. Otherwise, sometimes simply a steroid injection combined with some physical therapy does a good job of getting the inflammation down and then allowing you to correct your biomechanics to basically get rid of it. You may always have some clicking and popping in there. Rarely, if people have a lot of pain too, they'll also get a scope to their knee where you can shave the cartilage, but I would only generally do that after you've tried physical therapy and an injection. Unless your kneecap is dislocating, which is an entirely different area. And dislocating, I mean coming all the way out of the groove where you have to push it back in. So I hope I was able to answer your questions about why your knee might hurt when you go up and down stairs. If you like this video, we put out new content weekly, so please like and subscribe. But I can't give you any medical advice about your specific condition, because this video and all my videos are for educational purposes only. Thanks for watching.